Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry in Hampton, New Hampshire, and I'm here to answer some questions about oral cancer. One question that I do get asked is, what is oral cancer? So as kind of the name describes, it's a cancer that develops in the oral cavity in your mouth, which includes the inside of your cheeks. It could be on the tongue, it could be on the roof of the mouth, it could be underneath the tongue. And it could be anywhere on the sides of the tongue or on your even inside of the lips as well too. Another question that I do get asked is, what causes oral cancer? So just like any other cancers, is the genes inside the body that turn into abnormal, and then they start thinking that, okay, we need to multiply here, but they're multiplying not in a normal fashion. They have gone what we call as a mutation, or they have gone in a wrong side versus the normal. They go to the abnormal, just keep multiplying and lead to oral cancer. Some of the causes of oral cancer, sometimes it's genetics that plays a big role. If somebody has genetic predisposition to certain type of cancers, that can lead to oral cancer. And sometimes it could be a cancer that somebody had in other parts of the body, and it unfortunately traveled and it presents in the oral cavity. Also, smoking plays a big role. A lot of times we see that it's induced by long-term smoking, can lead to cancer, oral cancer as well too. Another cause of cancer is using tobacco and tobacco products. We have seen over the past number of years that if somebody does tobacco patches or they use lots of tobacco, even cigars as well too, that can lead to oral cancer as well too. Another question that I do get asked is, what are the early signs of oral cancer that someone should look out for? So some of the early signs, obviously sometimes it could be very, very silent, but sometimes some of the oral cancer signs are certain like redness patches in certain parts of the mouth. And if you notice that inflammation which is not going away, or it could be a dry white patch as well too. So those are some of the kind of early indicators that one can see in their mouth. Even on your lips as well too, or in your cheek mucosa, on the lining of your cheek, could be your tongue, any small elevated spot, again as we mentioned, could be a little bubble as well too, or red patch or a white patch. Another question I do get asked is, what are some of the common symptoms of oral cancer? Many times actually oral cancer could be very silent, and there are many times that it gets diagnosed with a routine exam. When you go to your dentist for a routine visit, they might see those signs as we talked about before, like any patches or any areas of inflammation which are not resolving, and sometimes patient may not have noticed. Other signs could be somebody's getting some burning sensation. Sometimes we have seen patients getting some tingling sensation, or some reoccurring like an ulcer in the mouth, which is just not healing over time. So those are some of the signs the patient can have. Sometimes, some cancers present as pain as well too, like a vague pain or discrete pain, or sometimes even shooting pain sometimes. But a lot of times it's more of inflammation or patching or ulcers in the mouth. Another question I do get asked is, can a lump on the gum could be a sign of oral cancer? Yes, it can be, because there are so many kinds of oral cancers, and also there are other cancers in the body that can present themselves out in the oral cavity. So you do not want to minimize if you're seeing any lump or any bump on your gums, any swelling. Make sure you get it checked out as soon as possible by your dentist. Another question that I do get asked is, what is the relation between human papilloma virus and oral cancer? So over the years, we have seen a huge connection between those two, that human papilloma virus leads to oral cancer, or can present itself as a oral cancer lesions as well too, or sometimes when patients have genetic predisposition to certain kinds of cancers, it can divert and turn into oral cancer as well too. Another question that I do get asked is, how oral cancer is diagnosed during a routine dental visit. So when anyone comes for a routine dental checkup, that is one of the parts where we are very consistent on checking when patients come in for their checkups, that we are basically evaluating your entire oral cavity. We are looking at how your tissue looks like. Does it look like the way it should look normal? Is the presentation normal of your cheek mucosa, lining of your cheeks, your tongue, underneath the tongue, sides of the tongue, tip of the tongue, your gums, roof of the mouth. Dentist is examining all that does it look like the way it should, like as a normal looking part of the mouth. But if they're seeing any signs, as we talked about before, inflammation that is not going away and there's not any other cause of it, any other source of it, or like lumps or bumps or patchiness, so then your dentist will ask you questions that have you noticed that, or if you haven't noticed, then they might recommend that you go for a biopsy if it looks suspicious. And also, besides just diagnosing clinically, looking at it, there are some devices available these days as well too, which kind of shine like a certain frequency of light, which can tell us that is this tissue, whatever we are looking at, is it normal cells or abnormal cells? And that's another way of diagnosing oral cancer as well too. Another question I do get asked is, what are the common treatment choices for oral cancer? So there are a couple treatment choices. Again, first of all, to diagnose, you got the biopsy done and they diagnose, okay, what kind of cancer it is. So a lot of times it's surgically, depending on what area it is. They might go in traditional surgical way, removing that affected tissue. And again, like depending on what was the extent of the distribution of any cancers, those lesions or cells, they will clean that out surgically. And there's also, they can do some chemotherapy or sometimes radiation therapy as well too. Another question I do get asked is, how important is early detection of oral cancer for the outcome? Early detection is probably one of the most important things that kind of comes into play when we talk about oral cancer. So the earliest we can detect it, that means that it's a small area which is affected, that can be treated a lot more predictably with the least amount of invasiveness. So early detection leads to, again, the best outcome comes with early detection, because a lot of times when the cancer is not detected early on, it has really multiplied into could be in many areas of the mouth, or also even to the neck, or even other parts of the body as well too. So early detection is the way to go. Make sure, that's why we recommend that, go to your dentist, make sure you're seeing them regularly, and your dentist is doing those oral cancer screenings and checkups every time when you're getting your exams done. I hope I was able to answer some of the questions related to oral cancer diagnosis, treatments, and how early detection plays a role in the outcome of the disease. So if you have any other questions, please feel free to visit us at our website, www.smilesbythecnh.com, or please feel free to give us a call at 603-926-8827 and set up an appointment. We will be happy to help you with any of your questions or even doing your checkup as well too.